Dr. Jonas Apostol.
Hi guys, Happy New Year! So it's a brand new year for all of us, and I'm so excited to face the year because I believe that 2022 would be our year. Pero grabe yung Omicron ngayon is very infectious. But the good thing about a lot of mga Filipino people naman na naka-vaccinated na, so yung mga tinamaan medyo umokay, so praise God, and everything naman, everybody was safe, and yung mga mga kilala ko pala na nagka-COVID, okay naman sila, okay yung recovery. So it's still a good thing because naka-recover sa mga ganong klaseng sakit. So I'm excited to showcase a lot of cases that we've done and we will be doing. So ang daming cases, it's life-transforming decision, of course, sa pasyente, and also my obligation is to provide that dream into reality, no, which is that beautiful apostolified smile. So I will be presenting another smile makeover case here. So this person is a 30-ish year old female. She's actually based here in the country and a mom also. And ang dami niyang gustong mangyari especially with the teeth, no, because we're not also dealing with the aesthetic of the teeth, but also the health of the teeth and the periodontal health as well. So this patient went to my clinic with the chief complaint of this unsatisfied smile. She told me that she doesn't like the appearance of her teeth.
Dok, ayoko talaga ng smile ko.
It went a lot of dental treatment from orthodontics, the braces, and to restorative, mga pasta, something like that. So currently, as you can see here, may pasta siya na malaki on the two front teeth, no? So it's not that obvious, but she doesn't like the totality of her smile. It looks okay naman, pero there are diastema, yung mga spacing, and also medyo nag-stain na talaga yung kanyang pasta sa front teeth, and palaging nababasag. So every few months nababasag kaagad. So she's actually fed up with visiting to a dentist, especially right now, it's pandemic. So ayaw niya na every month nandun siya sa dentist just to fix the same tooth, no, that's causing her a problem. Nababasag siya, legit chipped. So it really depends kasi on the case. It depends on the technique, and it depends on the totality of the the relationship of the maxillomandibular teeth in relation to biting, and if there are something occlusal problem or mga nagagrind. So we have to make sure that we assess everything. So first visit, number 1, parang all the diagnostics, gagawin namin yon by taking the charting. Kinukuha namin yung chart of the teeth, the condition of the teeth, kung merong sira, kung may pasta or normal, something like that. And also we check the periodontal health, if there are gingivitis, periodontal disease, and also yung mga endo problem, yung mga kailangan i-root canal. So after getting all the diagnostics, of course, doon na papasok yung assessment natin. So may mga photography and x-rays, so we were able to check the health of the teeth clinically, and also the concern ng pasyente, and also yung x-ray. Natingnan natin kung ano yung mga kailangan na ayusin. Let's say may mga problem doon. Okay, on the clinical assessment, I've seen that there are a lot of concern, like the height of the teeth in relation to the face. It looks really small, and she wants to have that beautiful smile na nakikita effortlessly, but in a healthy fashion. We don't want to create something that would cause trouble, especially with the bite, no, because it will ruin everything. Na-mention niya that she doesn't like the color of her teeth because it's a little bit yellowish. So, gusto niya din na papaputiin konti, but not too white na hindi naman babagay sa kanya. So, what I assess here in her case was the problem in like distribution of the line angles and also medyo a little bit less volume on of the teeth, especially on the canine and premolars due to like spacing relapse thing happened after, you know, orthodontic treatment. So madami tayong pwedeng gawin dito, but as you can see here also the color of the gums is a bit ano naman, medyo maayos, wala tayong problem. Doon lang may mga extension, a little bit of composite on the two front teeth, no, may konti doon, pero hindi naman siya naging issue. If let's say for example matagal nagkaroon ng problem, then, you know, matagal yan siya dyan and then hindi siya nagawa ng paraan, it will cause irritation to the gums that would lead to gum disease, which we don't want that. Also, as you can see here, yung mga ngipin niya, worn na, medyo a sign of yung nag-grind yung pasyente kasi ang liliit na, nag-grind down niya na yung mga canine lalo, and may mga a little bit of chipped on the incisal area of from premolar to premolar, no, and also the color of the filling material has changed. Medyo kulang din to sa polish a little bit, so may mga issues tayo, minor issues here, pero if we try to fix all of these things, medyo complex din siya, so we have to think about this and plan this treatment systematically. Okay, so on the second visit, dun na yung time that we will do the preparation. So during the preparation of the teeth, syempre before we start that, kailangan, you know, you're gonna sign a lot of mga papers if, you know, she's healthy or something like that, o damit, may mga pinapasign tayo. And also we discuss it again, recap all the things that we have to do before we proceed, no. Another thing, the design is very, very important. So there are two method akong ginagawa. Either I do a direct designing to the patient, or if it's straightforward, then I can do a wax designing sa laboratory. So I have my own laboratory and I can control everything, dictate the design based on what I can see or what I saw in the patient's face and teeth, no? So this preparation thing, yung preparation of the teeth, it is under local anesthesia. Hindi naman nakatulog yung pasyente, hindi na pinapatulog yung pasyente dito. It's quick procedure, siguro mga around 2 hours or more if it's complicated, but this case around 2 hours lang. Pero hindi naman siya ganoon na 2 hours straight kasi may mga rest in between, like 5 minutes, something like that, just to not traumatic to the patient and a good experience at the same time. So after the preparation, final impression, then we put in a temporization or the temporary veneers based on the design that we did in the laboratory, and then we do the final restoration or veneers for about 7 to 10 or 14 working days, depends on the case pa din. And yun yung waiting time for the patient for us to go to a third visit. So before the procedure, I discussed the material to be used for her case. So in this case, I'm gonna use an indirect lithium disilicate veneers or emax porcelain veneers. That's a brand name. Yun yung magiging material namin. The shade that would be suitable for her would be the shade B1. So we thought about it, but you know, it's more of like me getting that good observation, what works or what's best for the patient. So why not composite, no? So in this case kasi we're gonna do an 8-unit indirect emax porcelain veneers. In that sense, it requires a harder material. As you can see, there are a lot of issues with her teeth, like the chipping of the teeth, paulit-ulit na lang yung two teeth niya na composite. There's problem with the bite, obviously, and as you can see also, incisal edges of lateral and canine as well as the premolar area, medyo problematic. So it's a big sign that there's something wrong with the bite. So I need to check everything. I need to make sure that the occlusion is on point. And we have to recreate the teeth, not just the beauty, but also the mechanism. Okay, whenever she bites, dapat yung mga interferences will be gone and it will be replaced by something more adaptable to the jaw and to the muscle. So, yun yung ginagawa. It's more of like mechanical thing and dapat naayos natin yun. So, it requires a way stronger, higher flexural strength material in emax porcelain veneers.
Several days later.
So on the 10th day, that's the third visit, so it's actually due for try-in. So before we place in the final veneers, we have to make sure that it is bagay siya to the patient and it should be 100% fit sa kanya. Kasi, we have to make sure everything's on point before we place it permanently because she will be using that for, if not the rest of her life, but 5-10 years, it will stay there. So dapat we'll have to make sure that it is on point. It is beautiful and maayos dapat. So after the try-in, so maayos yung fit, everything's on point. The design is maganda, a little bit whiter than the normal, and then distribution maayos. So after the try-in, nakita namin maganda, maayos, so we decided to cement it permanently. So after the cementations, you can see here, a lot of things has changed. Dami, the color of the teeth, obviously, hindi na siya ganun ka, effort. Mag-smile, nakikita na agad. It looks beautiful, whiter, brighter. Yet, it's not like super duper white na parang mukhang fake. This one looks good, very straightforward. And also, the patient wanted to have a little bit of, volume to the teeth na nabigay naman natin. The appearance of the canine, it looks really beautiful. Especially with the architecture of her smile, the lip. So, bagay na bagay sa kanya. Also, with the color, it complements with the skin tone. No, it looks really beautiful. And intraoral images shows also here that the gums, super ganda. Wala na siyang problem. There is no sign of any gum problems, impingement or something. And nag-adapt kaagad siya in just few days lang. So on the 4th visit, it's a follow-up visit. Okay, so in the follow-up checkup, tinitingnan natin doon if there are any excess cement. We clean everything just to ensure that everything's clean, on point, no excess cement. We also did the T-scan and checking the occlusion if there are any interferences that would create problems in the future. So we eliminated that. And also, night guard. It's very, very essential and vital after the final cementation because it will really help you get rid of, clenching or something, especially pag bago pa lang kasi our teeth tends to grind if you have like smile makeover like this. So we have to really protect the teeth and the veneers as well. Overall result of the patient's case, sobrang happy naman siya and I'm so happy for her. And it looks really natural and beautiful. The one that we have to do something is to add volume sa teeth niya para at least it would look visible, effortless smile, beautiful smile that is whiter, a little bit brighter, and healthier version. It's an apostolified smile that, creating a statement is 2022. So, ang gandang pasok sa kanya to, ng year na to. And yeah, very, very exciting year. So, the importance of having this smile makeover is number 1, the health of the teeth and also the occlusion. We can be able to correct that. Number 3 is like the beauty from within, the beauty that it can give you, the confidence that was lost na ibabalik natin, the youthful appearance of the teeth in relation to the face. It actually creating a big impact. These are facts and things that we do here that would create something for you.
And if you're breaking the bread, I need your hands in the air like praise. Just need to see my family fed.
Back when I ain't get no spins, basement
So Happy New Year, everyone. I hope to see you soon on my next vlog.
Yeah, I never fit in. Now you're talking, claim that I'm your friend. I can tell who can ride for me, be beside for me.